Go.
Good afternoon, everyone. This is Dr. Lalitya, Fertility Specialist, Oasis Fertility Center, Tolichowki. Today, we'll be discussing about what to expect during your first visit to a fertility clinic and how to be prepared to make your first visit less overwhelming. So, first step into any fertility treatment can be equally exciting and stressful for all the couples. So, our main goal during your first visit with us would be to build a roadmap of fertility journey, where you have come from and where you are headed to. So, for you, the first step would be booking your appointment. So, when you book your appointment, there are two main things which you have to keep in your mind. The first thing is that you need to allocate a full day for your appointment, as your primary evaluation is a time taking process, and we cannot assure that we will finish your diagnosis and treatment in certain time without knowing your history. So, the first visit will need a lot of time. And the second thing is, do not rush in your first visit, and do not please cooperate with our staff so that your visit will be much smoother. And at Oasis, we work as a team, and as a team, we are more efficient. So when you visit our center, our team of receptionists will assist you with your appointments, and they will guide you through the registration process. To make this process easier, please carry your ID proof, preferably Aadhaar cards of yourself and your partner as well, as these details are to be updated with the art registry as per the new ART law. So the next step would be meeting the doctor. Once you finish the registration process, you will be meeting the doctor. So when you come to us, what we do is we try to take your detailed history, current, present treatments, which if you're undergoing with any clinic previously before coming to us, or previous treatments, medical conditions, your surgical history. Every history will be taken in a detailed manner. So this will take at least 15 to 20 to 25 minutes. So do not rush through your history process, because it will give us a very vital information regarding your health condition and what are treatments you have already taken. And for it will also be useful for us for further planning your diagnosis and treatment. And next, one more important thing is you have to attend this session, the first visit, always with your partner. And to make the process easier for us, it is better you carry your previous reports. So whatever reports, whatever treatment history you have, if either it is a soft copy or a hard, or if you have hard copies, if you can bring the reports, so we can go through the reports, we can understand your current treatment, whatever you're undergoing, and also according to that, what medications can be avoided, and if you're allergic to certain medications, we'll avoid those medications. So these are the things which will give us vital information. So please carry um, all the old reports which you have. Okay. And also, you should have a list of questions for your doctor. It is important that you ask your questions from your point of view, because this will be able to give us a lot of information about your understanding regarding the treatment, and also what you are expecting from us can also be put in your words when you start asking questions. So whatever instructions we will generally give after taking your history, it will be given in a written or a print format. So we expect you to please follow the instructions diligently. And once we are done with the history, we will give you a detailed diagnostic and treatment plan based on your history, and also after we do a basic physical examination. To make things much more simpler, we advise the couple to plan their appointment on the second or third day of a woman's menstrual cycle, which is an ideal time for certain investigations and for a baseline vaginal scan. This way, we can avoid multiple visits just to decide on diagnosis and treatment. And for the male partners, generally the basic test which we would do is a semen analysis. Semen analysis, for this, we generally advise a minimum of 3 days to 5 days abstinence for taking a sample. So if you can plan accordingly considering these factors, you will not face any delay in starting your treatment process. And then after this, you will be called for further visits, which would be your regular visits once your treatment starts, and those visits will not take much of a time. So that is why we stress on being very keen about the first visit, because in first visit, what we do is we try to consolidate your history, we examine you as a couple, and we try to analyze where the problem is, and we try to start treating both simultaneously in case the problem is with both the partners. Otherwise, if it is only the single partner, we still advise you to come with the couple, because for certain procedures we need the consent of both the partners, like the wife and husband. So even for all those things, you will need to have consents. Okay, so you need to come as a couple is what we advise. And coming to the type of what is would you want to know about this would be like the treatment protocols will vary for different patients. So you cannot right away come and ask for like I want IVF, I want IUI. There are certain procedures which we generally do. So for any kind of treatment, before we start, we do a basic evaluation. And in case if you have already done certain investigations in the past year or within the last 3 months, there are certain investigations which we consider which are valid, but there are investigations which you have already done. Some patients might have already visited 3-4 fertility centers, and the fifth time they'll be coming to us. But the duration of the investigations, the validity of the investigations might have expired, which is why we will ask you to repeat the investigations. Otherwise, if they are within the valid time period, we will not generally repeat your tests. And if there is any issue, for example, if it is a thyroid problem, patient is on thyroid medications and she has already been taking thyroid treatment, and if the thyroid values were high previously within a period of 3 to 6 months and she was started on treatment, we will generally tend to repeat the test just to check if the treatment has any effect on the patient or not. So you should not misunderstand this as we are trying to make you do more and more investigations. For every investigation we advise, you can always ask us a question why we have to repeat the test, and we will give you a clear explanation for every test. Okay. Then is there anything which you would like to know specially regarding the first visit? I'm ready to answer right now. So these are the basic things which we would like to stress on in the first visit. Bring your ID proofs and bring your old reports. These two are very, very crucial, and come along with your partner. Plan accordingly when if it is the second or third day of your of the female menstrual cycle, and minimum of 3 to 5 days abstinence for a male person to give a semen sample. So these are the things. Can we expect any questions now? ID proof, yeah. So basically, ID proof you can bring either Aadhaar card or your driving license or any attested your address proof. So if you don't have any address proof, you can write your address and you can self-attest it and you can give it to us. This is not a rule made by us, but it is according to a new ART law. We need to collect all the ID proofs, because whatever treatment we start in a fertility center, we need to update it in the ART register. Okay, so for this purpose, the ID proof is compulsory. And also, it also gives us the exact age of the patient. So we need to have a proof of age. So that is also one reason why we have ID proof. What kind of diet should I do to improve my fertility? Okay, so coming to diet, so basically diet, try to avoid sugars, caffeine, red meat. If you're a non-vegetarian, try to avoid red meat. And since we are South Indians, we tend to take a lot of rice. So rice has a lot of carbohydrate content. So basically, the proportion of carbohydrate should be reduced, and the proportion of protein should be increased in our diet. So in that case, we would advise you to take for vegetarians, you can take paneer and milk. So these are the things which are rich in protein, and legumes, green leafy vegetables, which will give you vitamins and minerals. And for non-vegetarians, you can take fish, chicken. Try to avoid red meat, and you can take egg every day. So it is a rich source of protein. So these are the foods which you can take, and try to avoid bakery foods, the foods which have a lot of maida and high sugar content foods, caffeine. Please avoid this and try to minimize it if you cannot avoid. Okay. Recently affected with COVID, will it affect my fertility? Okay, so recent studies have shown that COVID has effect on the sperm quality. We wouldn't say that COVID will not affect the fertility. Yes, it can affect, but any acute infection, like any acute infection, it can affect the sperm quality. So when we do a sperm semen analysis during acute infection, there will always be altered semen parameters. So generally what we advise is post-infection, after 4 weeks, we advise you to repeat the sample to check if the sample is normal or not, if the analysis is good or not. If there is any abnormality, we will try to further analyze it and try to treat the condition. In case if you are affected with COVID, what we are advising is you need to wait till the infection completely subsides, and then we will have to do a semen test and then check. Okay. What is the validity of blood tests which are already done outside? So it depends on the kind of tests which you are doing. So if it is viral markers like HIV, HBsAg, VDRL, which are routinely done with us, HCV, these tests have a validity of 6 months. If you have gotten them done over a period of 6 months, you don't have to repeat the tests, and we will consider the old tests. Okay. If it is other tests, like I have already mentioned you, if it is a thyroid test or if it is a blood sugar levels, which needs to be monitored continuously. So if it is over a period of 3 months, 3 months back you have done a thyroid test and you've started treatment after that. So we will definitely repeat the test. And if you have already done a test in the past 1 month after starting the treatment, then we will consider that report. Okay. I have been married for 8 months but didn't conceive yet. Do I have to consult a fertility specialist? Okay, whether you have to consult a fertility specialist or not, it depends on multiple factors. First thing, like you have said, you have been married for only 8 months, so you can wait for another period of 4 months. And if you're having unprotected intercourse over all this time, or like for a period of 12 months, only then we advise you to, and still if you did not conceive, only then we advise you to come to us for treatment. In case if your age is more than 35 years and if you've been married for 8 months, yes, you should come to a fertility center and get yourself checked up. Okay, because age plays a major role. As your age increases, the egg count, the antral follicular count, and the egg reserve will generally come down. Okay, so in these cases, it is vital that you have to visit a fertility center, or in case if you know that there is already an existing problem with either the male partner or a female partner. So in that cases also, if you are married even for 6 months, you can come and visit us and we can evaluate you and plan the treatment accordingly. What are the challenges in planning pregnancy in irregular periods? Okay, challenges only, right? Yeah. So if you are having irregular periods, first thing what we do is we try to identify the cause for irregular periods. There are multiple reasons why you might be getting irregular periods. It could be because of PCOS, it could be because of hormone imbalance like thyroid, hypothyroidism, it could be because of hyperprolactinemia. So that there are multiple causes why your irregular periods are there. So first we need to identify the cause and treat the cause. So for that we will start you on certain medications, whatever the cause is, we'll try to treat that first, and then we'll go about in giving your treatment for fertility. And also certain certain lifestyle modifications will also be advised if you have conditions like PCOS. If you change your lifestyle, weight reduction and dietary changes and certain medications will be added. If you follow them regularly, your condition can be improved and automatically your periods can be regularized. Using contraception affects my fertility. Okay, so there are different methods of contraception. Generally, most commonly practiced contraception is barrier method. So if you're using barrier method, which is condom, if you're using that, it not only prevents it not only acts as a contraceptive, but it also prevents you from sexually transmitted diseases. So another advantage of using barrier method is that it is a reversible contraceptive. Like as soon as you stop using it, there are chances that you will get pregnant. But there are other contraceptions. There are short-term, long-term contraceptive methods. Certain patients tend to use pills over a period of uh, if you're using it for one cycle, yeah, it is still okay, 1 or 2 cycles. But if you're using it for over a longer period, over a period of 3 months, 6 months, over a period of 1 year, we would say that yes, it will definitely affect your fertility and your egg reserve. Okay, so it is better always to use a barrier method and barrier method of contraception if you are trying to use a contraception. And yeah, like you said, like we know that barrier method, the failure rates are a bit more. But still, if you are using, there are female contraceptives also, female condoms also, which are available, which you can use, and so that the contraception would be better. So, in case if you are planning for pregnancy after a period of 1 or 2 years and you want to use a contraception, barrier method would be a better option, uh, because considering if you use medications over a longer period of time, your fertility can be affected. Okay. Thank you so much. If you have any other queries, you can please post in the inbox and we will get back to you. Please visit Oasis Fertility for your treatment.